Good evening, and welcome to the Arkansas Minority Health Commission's 30th anniversary celebration. I am Esty Frazier, Interim Director of the AMHC. To help us get started, please enjoy this message from Arkansas Governor Asa Hutchinson.
Hi, I'm Governor Asa Hutchinson. Welcome to the Arkansas Minority Health Commission's 30th anniversary celebration. For 3 decades, the Commission has worked to make the health of Arkansas's minority populations a priority. Today, we are here to recognize and honor their work. As you reflect on the Commission's accomplishments, you will have the pleasure of hearing from a panel of leaders and pioneers who have paved the way for the Commission and whose work made life better in Arkansas communities. You will leave today inspired to continue the Commission's legacy.
Thank you, Governor, and thank all of you for being here. We are here to celebrate the AMHC's 30 years of service to Arkansas communities and to honor the trailblazers whose leadership has continued to push the mission of the agency forward. I would also like to take this time to recognize and thank those who are in attendance from the Arkansas General Assembly, the Arkansas Legislative Black Caucus, the Arkansas Department of Health, AMHC partners, past commissioners of the Arkansas Minority Health Commission, and current AMHC commissioners and staff. We have a full program for you today, so prepare to take a walk with us down memory lane as we hear stories of the AMHC's inception, as well as the work done that brought us to 30 years. All of this will be shared through the eyes of one of the AMHC's founding members, as well as our former directors who will share the many ways their initiatives throughout the years helped improve health disparities in Arkansas. To moderate this panel, I would love to introduce the AMHC's Commissioner, Cedric Rice.
Thank you, Esty, for having me. I'm excited to be here today to celebrate AMHC's 30 years of excellence, service, and commitment to the state of Arkansas. Now I'm honored to introduce our first panelist. She was very instrumental in the founding of the Arkansas Minority Health Commission in 1991. Please welcome former U.S. Surgeon General and State Public Health Officer, Dr. Joycelyn Elders. Dr. Elders, welcome. Please tell us a little about the start of the Arkansas Minority Health Commission and your role in getting the commission off the ground. Why was there a need for the Arkansas Minority Health Commission?
Well, when we look back 30 years, 31 years, look more than almost 32 years now when we really think about it. And I'm sure Tommy will remember that too, when we were kind of sitting around the table, talking about it, discussing it, trying to decide what it is, what we need to do, and where we need to go, and whose arm we would have to twist in order to, and we wanted to be something that was upgoing and sustaining, not just something that we started and we worked hard on this year, and then the next group came along and forgot about it next year. The only way to make something sustaining, you have to be able to convert public policy of our ideas into public policy and get them put into law. And I think I probably twist and pushed, but I think probably people like Tommy, the first director, was over begging and pleading and twisting arm and with our legislators even more than me, because that was when they didn't talk to women very much, but they talked to me because I was so loud and boisterous and in the way. But anyway, I was able to make sure they understood the need for a Minority Health Commission. And the reason I felt so strongly that we needed this commission and we needed someone out there fighting all the time is because I had just gone to Washington. They had just gotten back huge report on disparities in the United States and what was going on. And then when I looked at those and compared them to Arkansas, we was even at the bottom of the United States. In fact, we always walked around and said, "Thank God for Mississippi." But what we were able to, what we found that a maternal mortality rate was one of the highest in the world. Our teenage pregnancy was one of the highest. We was having, our life expectancy was very low. We had a very high number of HIV was coming on the scene at that time. So and we had a lot of our young people dying with HIV/AIDS. Our low birth weight and our infant mortality rates were something that was horrible that we never really wanted to talk about. So there were a lot of reasons that we were concerned, and we had Dr. Stead was running around worrying himself to death about tuberculosis and trying to, he was one of the best known tuberculosis experts in the country, but we still had too much TB. So I'm saying we had lots of problems. Hypertension and stroke, heart disease, most common cause of death is the same as now, but we were far up, away and above the usual. We had a very high cardiovascular death rate. We had lots of hypertension, and we weren't even addressing those issues. We were just letting them sit out there, and we were doing the best we could, but no, we weren't doing the best we could, but we were doing something. And so we decided if we got a commission, or we got somebody who's responsible for making sure that we get this work done. Well, we found out we had to do lots of other things too. We had to educate people. People it wasn't that they didn't do it because they didn't know how or they didn't know. It was because we had educated. We had taught them how. We learned that in public health, it was our job to make sure everybody had the very best health that they could possibly have. So we really spent our time working on that. And that's how that commission was formed. Just kind of formed from us. We're starting before we even got the money from the state or anything. I just took little pinches out of each bureau in the health department to put together enough that we could have a kind of a director, at least for the health department, and we could go out and get started. And of course, Tommy went out and really worked hard and twisted arm and convinced Dr. Llewellyn and Dr. Jewell and Dr. The dentist. So between all that arm twisting, we ended up with the Arkansas Minority Health Commission. We ended up with a director, and we got off the ground. And I want you to know it's really made a difference, and I'm proud of every one of you. You've all done a good job, and I'm very proud, and we have to keep doing a good job.
Thank you, Dr. Elders. You were largely supported by the Arkansas Legislative Black Caucus. Why was that so important? And what are you most proud of? You talked about being proud. What are you most proud of when it comes to the work done by the commission?
Well, the Arkansas Legislative Black Caucus really probably, they was out there twisting arm every day and talking about the need, and we'd given them all the data. So they had facts to talk from with the other legislators. And so they were able to really began to convince them of why this was important. We all wanted to reduce teenage pregnancy. We all wanted to reduce infant mortality rate. We all wanted to increase the lifespan. We all wanted to stop throwing away so much money on, for welfare and sick care. We wanted to improve our health of all of our people. Nobody wanted to just live longer. We wanted to live better. So with all of that, going around talking and of course, it's because the Arkansas Minority Health Commission has continued to not just talk, but they've gone all over this state, twisting arm, begging, and getting people involved and talking about what we have to do to improve the health and welfare and education of the citizens of the state of Arkansas. That's our job. We've got to get it done. We want to get it done. We can get it done. We will get it done. So I'm very proud of all they've done. They never stop. They're always putting on a different conference. They're all, everywhere I look, I see a little sign, or they've got a van going someplace. So they don't just sit and write papers and talk about what we need to be doing. I'm very proud that they're out there doing it. They know what the people want, they know what they need, and they try to deliver. So I'm proud of you.
Thank you so much, Dr. Elders, for your vision and dedication to improving health disparities in Arkansas. Next, we have former and first appointed director of the AMHC, Tommy Sproles. He was director of AMHC from 1991 through 2001. Thanks for being here, former Director Sproles. You were there at the forefront, appointed by Dr. Elders to lead the commission. Tell us a little about your tenure and the original mission of the commission and how it came about.
First of all, I'd like to say, Dr. Elders said that the women weren't listened to back in those days, but thank God she was very vociferous about what she believed in. And if they didn't listen to her, I was going to repeat the same thing she said, so they might as well listen to her. We had a strong, very strong Black caucus, and Ms. Smith, you were a part of it, along with Dr. Jewell and Dr. Townsend and Senator Edwards and a few of those guys, and Senator Llewellyn. And we sort of, we knew what we were going to do when we went before the whole legislative body, because we had sat down and visited with those legislators. And when we presented the Act 912, it sailed through, but we were approved but not funded. There again, Dr. Elders came up with some money. We had, I think, $5,000 from her and $5,000 from Joe Hill at the mental health. And that got us enough seed money so we could have meetings to discuss our plan, to lay things out. And then we got Governor Tucker said he would give us $200,000 on his as a line item, or we could go before the legislature and get $200,000. And I chose the second route, so we would, continue to be funded regardless of who was governor. And then, of course, the tobacco settlement money came along, which I tell you what, I wore out 2 pairs of shoes and had gout and everything going all over the state, pushing this initiated Act 1, and it passed under Governor Huckabee, I think was the governor at that time. And the Minority Health got some money to do what it needs to be done. In my tenure, it wasn't because a lot what I had read. I had worked as a physician assistant to Dr. Worthy Springer. I don't know if any of you all remember Dr. Springer, but I worked for him for 19 years. And I saw with my own eyes the disparities that we had. We had, teen pregnancy rates were up, babies were dying, our little Black babies were dying. Hypertension and strokes was killing us every day. It was about as bad as COVID is now. And I saw this going on. And a lot of you are probably too young to remember the healthcare system back in the 50s and 60s when the hospitals were segregated. I don't know if any of y'all remember that, but Baptist Hospital had a Black ward. And whether you came in there with a stroke or to have a baby, you went to the Black ward. And the only thing separated us was a curtain between the men and the women. And you know, that wasn't right. The white doctors had black waiting rooms and white waiting rooms, you know. So we were just discriminated against in any possible way. And that I wanted to see a change come. And when God blessed me to meet Dr. Elders, I said, this is what we need. So we went out to address these issues, and initiated Act One. It addressed a lot of these issues. Ms. Frazier, you got your work cut out for you to keep this going. I know your funding is probably decreasing from what it was when Ms. Smith came on board, but you know, we can think of a way to get some more money for you. But keep it, just keep it going.
Thank you so much, former Director Sprouse, for giving us an overview of your tenure. We appreciate all you have done for health disparities in Arkansas throughout your years of service. Our second past director is former Arkansas State Representative Judy Smith, who had her tenure from 2002 through 2007. Welcome, former Director Smith. We would love for you to tell us a little about your time with the Arkansas Minority Health Commission and the top few initiatives that you implemented during your tenure to help improve disparities in Arkansas.
Okay, thank you very much. The top two initiatives has been a difficult challenge for me to pick 2 of 10, but I did prayerfully manage to pick 2. And they are Eating and Moving for Life, which was done in partnership with the U of A Cooperative Extension Service. And so I'm calling Eating and Moving for Life and Southern Age Fried Sundays as one partnership, because they are both based in nutritional health, moving your body in order to either intervene when you're diagnosed with diabetes, for example, or to try to prevent it from happening at all. And I was really, really, really pleased for Southern Age Fried Sundays. Before I left, we had over 200 churches that were sponsoring Southern Age Fried Sundays in the state of Arkansas. And they were not all African-American, to my surprise, but everybody wanted to do it. And more importantly, Pfizer Pharmaceutical became a big partner. I don't remember how they found out about Southern Age Fried Sundays, but they called me, and I went to the legislature, got approval, some special language in our appropriations bill so that we could sell the products from Southern Age Fried Sundays, the cookbook, the apron, and so forth and so on. So they paid for me to go to other states to talk to as many as 200, 300 African-American clergy people so that they could implement Southern Age Fried Sundays in their community. So that's my 2. So you want my third one? So my third one is the Minority Health Today show. The Arkansas Minority Health Commission started a television show. The topics range from hypertension, diabetes, various types of cancer, colon cancer, bone cancer, breast cancer, as well as prostate cancer and others. We focused a lot on making sure that we targeted these comorbidities that are more prevalent in the minority community. But what we did, the first show was probably still my favorite one, because it had my best friend in the world who'd had a massive stroke. Fortunately, she worked at the city of Little Rock. When she had her stroke, she told her staff, no, I'm fine. She fell, she couldn't get up, she couldn't open her door, and her staff still called the ambulance. So she was able to get to the hospital within 3 minutes, and 6 months later, she was able to go back to work full time. And we ended the show with her climbing this long flight of stairs. And what we did, we not only had a stroke survivor, a cancer survivor, a person with HIV, we had medical experts in that field to also be there to answer questions that we knew that the public would benefit from. And I made sure when they gave an answer that the public might not understand, I asked them to say it in plain English so that our viewing audience could understand what they were talking about. Now that show lasted for a while and we were very pleased with it. We had a contract with some small company. I apologize because I don't remember the name of the company. They actually we bought viewership in 13.5 million African-American households across the country. And I wish I remembered the name of the company, but I don't. And also with that show, I ran into former US Senator David Pryor at a Camden Chamber of Commerce banquet, and he asked, "Where's that show? I'm looking for it." I had been gone a few years by then. So he asked me to have the commission send him the DVDs, and I did. And as a result, the Minority Health Today show is on his and his wife Barbara's U of A traveling library. And that is so special that they thought it had that much value. Of course, his son Mark was my seatmate in the legislature, but Mark had bone cancer and he was our guest for bone cancer. And by the way, Huckabee was our guest for obesity. If you guys remember, he lost 110 pounds going to that UMS program. And Southern Air Fried Sundays, though it was named by my very young staff, the idea came from him on the show talking about being a minister in the South and how challenging that can be when it comes to food. Because Miss Jones makes a pie, now Miss Smith wants you to eat her pie too. Miss Brown fried some chicken, now Miss whosoever ever wants you to eat their fried chicken. And their feelings are hurt as the pastor if you don't taste all of their food. So we thought, okay, we've done Eating and Moving for Life. We've done Southern Air Fried. We hadn't done Southern Air Fried Sundays till after that feature show. And we thought, let's figure out a cookbook, and went to the Cooperative Extension Service. They not only helped us with the recipes, the healthy recipes, people could go there, and people can still go there and learn how to cook healthier at those Cooperative Extension Service offices. Now with COVID, they may not be doing it as much, but it was available, as was gardening. And I'll just move on to the next question if you want me to, Dr. Rice. The next one was the most helpful or most beneficial resources. Okay, my list is long, but I'm gonna try to do it in 1 minute or less. Obviously the commission, the Arkansas Minority Health Commission, UAMS, Dr. Shaw, especially, the Arkansas Department of Health, Dr. Joe Bates, Dr. Jennifer Delahaye, Christine Patterson, and all of the AMDPA members, the community health centers, for which we also had programs there. We had a hypertension program in 3 Delta counties that people were being referred to community health centers, elected officials across the state, churches across the state, the U of A Cooperative Extension Service, of course, I said that already, the College of Public Health, Dr. Cochelle Nash and Dr. Eduardo Ochoa, they conducted the disparities study in 2004. And when they conducted those focus groups, it was very much like that national study that had been released in 2002, the year that I was hired. The focus groups mirrored exactly. You're talking to 2 moms that work at Walmart. Both their kids have a really bad cold. The white mom is told your baby needs some antibiotics. The black mom is told your child got the croup, go get some over-the-counter medicine. And that stuff still persists today. And in addition to that, of course, the doctors in private practice, Dr. Alonzo Williams loaned us his home when we were recruiting out, doing a national search for medical director, and Dr. Fletcher, Dr. Hargrove, the late Dr. Gary Glasgow, and many others. And the National Institute of Health also played a big role in helping us. And obviously the HBCUs, I mentioned to Dr. Elders that panel she served on with us on HIV, and it was amazing. 750 students there, 98% got tested for HIV. And that's not all I have to say, but I'll stop right now. Thank you.
Thank you, former Director Smith. We appreciate you sharing your landmark initiatives that you implemented during your tenure that are still around today and making differences in Arkansans' lives. Our third former director is Dr. Winona Bryant Williams. She was AMHC director from 2007 to 2009. Thanks for being here, Dr. Bryant Williams. We would love for you to share a bit about your initiatives that you helped implement during your time with the Arkansas Minority Health Commission.
Thank you, and thank you for having me for this wonderful occasion. But before getting started with some of the questions that I was asked to address, I just have to recognize and applaud Dr. Elders, former Health Department Director and the former Surgeon General for the United States, for being a trailblazing visionary to bring to the forefront the necessity to address health disparities related to minority populations. I would also like to recognize the work and service of both directors before me and since my tenure. I was appointed to the commission by former Governor Mike Beebe, and during my directorship, I was most proud of the work we did with the Marshallese population in Northwest Arkansas, and also the work that we did with the HIV/AIDS initiative under the leadership of Patricia Minor. We had the opportunity, Patricia applied for a grant and she was accepted into a program, I believe it was in Los Angeles. It was sponsored by the HIV/AIDS Foundation and the Black Church. They were very concerned about the increasing numbers. At one point, we had started our numbers in AIDS had started to decline somewhat. But when we got involved in this initiative, they were rising again. So this gave us an opportunity to establish and continue with the partnerships that were already doing some AIDS work. And so our partners were pretty much the same as Mrs. Smith worked with, so I won't go through that list again. But I will say that I was particularly proud of the work that we did with the Cancer Coalition. I experienced my own battle after about 6 months after leaving the commission with breast cancer. And I think my success with that was because of early detection. And that is something we must continue to stress in our minority populations. Early detection is key. And Dr. Elders, with the first disparities that you addressed in establishing the commission, and Mr. Sproles continued to work with those same health disparities. As time evolves, so should the commission evolve. And so now we need to look at cancer. I'm a living witness on that one. Renal diseases. And one that I am particularly interested in, that I would hope that we could have more presence, is with mental health. In the Black community, we don't like to talk outside of the family. I can remember my parents saying, don't talk outside of the house. And mental health has such a stigma placed on it that we just don't want to talk about it. If we stump our toe, we have a stomach ache, we go to the doctor for that. But when it comes to the mind and the brain, we're just not as quick to address those kinds of issues. And I am particularly concerned about the mental health stresses this pandemic is going to impact all of us. And again, I'm very concerned about our children. Their social and emotional skills have been perhaps delayed, not knowing just how to interact with others. That's very important to their development. So I don't think we've seen the tip of the iceberg as far as this is concerned. But I was thinking we could establish more partnerships with those professionals who are in the mental health profession. And we need to have more of a presence. And maybe you're already doing this, but if you're not, I would ask that you would consider, Ms. Frazier, including mental health issues in your work with the commission. Communication is key. We don't know how to express our concerns and needs, our mental health needs. And I think that would be worthwhile. And then when we go into these communities, there needs to be greater follow through and follow up. Don't just go in, come out, and that's the end of it. So when you consider working with your partners, be very mindful of how you frame your partnerships that will allow you to go back in. We know that medical issues, that's confidential, but at least go back and continue the communication with those persons who are impacted. Mrs. Smith mentioned about the television program. That was an excellent program. It was still going on during my administration and our directorship, and we were impacting many households that appreciated and gained great information from that show. I was really disappointed when that show was no longer a part of the work of the commission. And of course, Ms. Smith, the Southern Ain't Fried Sunday cookbook, we can all benefit. You know, we like our fried chicken, mac and cheese, and candy yams, but that was a very, very popular and much needed piece of information. And so it was very helpful to see that book published. And I hope it's still going. Ms. Frazier, you can address that. But I just hope, in closing, I just hope that we will continue to address disparities as they evolve. Now, we've got other minorities coming into our state that we need to be inclusive in including them in our initiatives with minority health. And with that, I think I will close. I enjoyed my time with the commission, and I wish the best for you, Ms. Frazier, and I hope that all of the other former directors are doing well. And thank you so very much for your service that you provided to the commission.
Thank you so much, Dr. Bryant Williams. We are very appreciative of all that you have done for health disparities in Arkansas throughout your years of service. Our fourth former director is Adonia Gardner. You might have known her as Adonia Trotter. She was appointed director from 2009 through 2014. Thanks for joining us today, former Director Gardner. You were involved in quite a few legislative initiatives that affected health disparities in Arkansas and its communities. Please tell us a bit about how they shaped your time at the Arkansas Minority Health Commission.
Well, thank you, Dr. Rice, for that introduction. And before I start, I just also want to say thank you to everyone that's on this panel. It's such an honor to be here and to be in history among those who have that passion to see the health disparities in Arkansas eliminated one day, eliminated completely, hopefully. But it's an honor to be here with all of you. So during my tenure, there was indeed a strong emphasis on policy initiatives to improve the health of minority Arkansans. And as Dr. Elders talked about, policy has always been a part of it. We know that we have to be able to have those broader systemic changes that policy can do in order to see broad impact as we do the health fairs, as we do the programs and the initiatives. Those policy initiatives are very important to make sure that we're making long-standing systemic impact as well. With a broad mission of ensuring that all minority Arkansans have access to health care, we took a four-pronged approach at fulfilling the legislated mandates and the purpose of the commission around policy. These included research, outreach and education, coordinated collaborations, and indeed a strong policy agenda. So related to research, we were blessed to have strong medical directors such as Dr. Chriselle Nash, Dr. Rhonda Maddox, who ensured that the commission was always abreast of the relevant and timely research on diabetes, on smoking, on heart disease that impacted minority populations. We had to stay abreast of the current trends in the data on disparities in health and health access. That research would then be available to inform state leadership and inform even our policy interventions.
The outreach and education was hugely important. And you may ask, what is outreach and education and talking to people about their own personal health agendas? How does that have to do with policy? I would advocate that it has everything to do with policy. So as we connected with thousands of minority and underserved Arkansans annually to outreach, educate, and create greater awareness around health, these outreach and connections allowed us to keep our fingers on the pulse of the community. And it gave citizens of the state that we talked to in those town hall meetings and lunch and learns and community meetings, it gave them a seat at the table, so to speak, that in a way that as they shared with us their concerns, as they gave advice of what they felt needed to happen that would impact their health personally, we were able to then take those information or that information back to lawmakers so that there could be personal stories associated with why policy changes were so important. The coordination aspect, that third prong, coordination among organizations and collaboration was so essential from the beginning of the Minority Health Commission all the way until today. The Minority Health Commission, we recognize that we cannot do this work alone. So during my tenure, we expanded the Arkansas Minority Health Consortium, in which the commission facilitated the coming together of representatives from multi-sectors to discuss the most prevalent policy needs that could maximize our effect on eliminating health disparities. And I'm going to get in trouble. Dr. Smith, Judy Smith, as well as Dr. Winona Bryant, they have mentioned so many partners that I could rehash here, but I'll just mention a few others. AARP and Arkansas Advocates for Children and Families, and the close partnership with the Arkansas Department of Health and UAMS and the Legislative Black Caucus and Coalition for Tobacco-Free Arkansas, and so many more, sickle cell support services. All of these partners were crucial in helping us to not only push forward our policy agendas, but we were there to support them as well with policy agendas that they had that we knew would impact minority health as well. And that last part, policy initiatives itself. With our policy initiatives, we took the approach that when we improve the health of our most underserved communities in the state, we will inevitably improve the overall aggregate health status of the state as a whole. So through our legislative policy initiatives and with the help of those many partners we've already talked about, we were able to see some broad impact for hundreds of thousands of Arkansans through several pieces of legislation during those years. But for the sake of time, I've been asked to only highlight two. So I think we would all say between 2009 and 2014, the most important piece of legislation during that time was the Affordable Care Act. It was huge. It was monumental. All those stories that we were hearing out in the community of people that were working 3 jobs but still couldn't afford health care. They couldn't afford to go into the hospital, but for not being able to pay the bills. That's the basic essentials of it. Someone who had worked all their life, maybe in a high-level job, but for an accident, all of a sudden putting them on skid row, so to speak. They could not afford to it. So we knew that if we could see the passing of the Affordable Care Act in the state of Arkansas, we knew that it would meet a tremendous need around our legislative mandate of healthcare access for minority populations and underserved populations. So between 2010, when the act passed nationally, March of 2010, it passed under the Obama administration. From 2010 all the way to 2014 of my time of going, we know that the law passed in Arkansas as the private option. We did community meetings. We documented over 300 community meetings between 3 years. And that's a lot of meetings in churches and communities and neighborhoods. We went wherever anyone would open the door to break down that 1,000-page document and ensure citizens understood, and then they were empowered to talk with their elected officials about what they felt was the right thing to do in Arkansas. We met with the Minority Health Consortium. We did legislative breakfast. We initiated our first State of Minority Health event our first Arkansas Minority Health Summit. These were meant to bring public health advocates to the table to keep them aware and informed of the health needs of minority populations around the state. And we were so pleased when the private option eventually passed in Arkansas, which expanded eligibility for Medicaid to more than 200,000 plus uninsured and underserved residents. It was a huge win. I know it's going through all kinds of changes, but yet and still, during these time frames, we know that many of those that we serve at the Minority Health Commission were impacted positively. And finally, the last one that I think made a major impact during my time there in the Board of Commissioners that I had the pleasure to serve under, we're very proud of Act 909 of 2011. This was sponsored by Representative Reginald Murdoch. This act improved access to treatment for adult sickle cell anemia patients in Arkansas and granted the ability to subsequently establish in 2014 an adult sickle cell clinical program at the University of Arkansas for Medical Sciences. That program is still running strong. They even have a 24/7 hotline that sickle cell patients can call into when they're in crisis or just to get general information. It was so important that the Arkansas Legislative Black Caucus, UAMS, the consortium, and we'll remember the late Jermaine Johnson and his wife, Lakeisha, who were relentless advocates and impacting for that disease in the state of Arkansas. I want to thank, and I would be remiss as I close if I didn't thank the passionate staff at the Arkansas Minority Health Commission during my tenure, and no doubt throughout it's the lifetime of the Minority Health Commission, who had the expertise in culturally connecting people and then crisscrosses the state to make sure that we meet people where they are. Finally, I want to thank the board of directors that I had the pleasure of serving under, those leaders, the chairs, Vivian Flowers, Dr. Linda McGee, Miss Chris Patterson. I want to thank the Arkansas Legislative Black Caucus. We couldn't have done it without you, the governor, the state leaders, and the consortium. And last but not least, thank you, Dr. Elders, for the work you did to lead us in this direction that's made a huge impact to make sure that all Arkansans have access to health care. Thank you.
Thank you so much, former Director Gardner, for giving us an overview of your tenure. We appreciate all that you have done for health disparities in Arkansas throughout your years of service.
Thank you.
Our fifth former director is Dr. Michael Knox, who had his tenure from 2015 through 2016. Welcome, Dr. Knox.
Thank you, sir.
Please tell us a little about your time at the Arkansas Minority Health Commission and details about a few of the initiatives that you implemented.
Thank you, Dr. Rice. First, let me acknowledge just how truly honored and privileged it was to actually be executive director of the Arkansas Minority Health Commission, and basically because of the foundational work that Dr. Elders actually implemented. And so it took and continues to take exceptional people like Dr. Elders to promulgate forward the rights afforded to all of us. And so to my esteemed executive directors, you know, the work of AMHC has never been easy. However, each of us took our opportunity to address those inequalities and inequities in a system, and we attempted to erode and or erase that from common practice. So I am so humbled to be a member of this prestigious group. So to kind of touch bases on my tenure at the Arkansas Minority Health Commission, it's an interesting fact to kind of sit here and listen to former executive directors and roll off all of the many accomplishments that they did. And from director to director, a lot of these activities continued on. And so I won't step back and acknowledge all of the great work that everybody has done, because when I was there, we continued a lot of them, and I applauded each and every one of those individuals in the efforts that they did. One of the things that I'll have to admit that I'm most proud of was the overall investment in the human capital, both inside and outside of the agency. And when I first got there, one of the things that I wanted to do before I did any activities or events was to sit down with the staff and ask them for some upfront trust and let me earn the rest. Because as Executive Director Gardner said, you know, these individuals have the level of expertise in order for us to move forward. But I needed their buy-in in order for me to put my vision to the overall mission of the agency. And so we talked extensively on what they viewed and what they valued. And I offered up myself to them to make sure that we can actually move forward fastly and aggressively. So that was one of my greatest accomplishments, because I got the necessary buy-in from them in order for us to kind of move forward and carry on with one of the largest initiatives that we did initially was the fourth biennial Arkansas Minority Health Commission. And I worked across the board with some great commissioners who had some great ideas. And ultimately what we came up with was we had the fourth biennial summit was on social determinants of health. And we talked about violence all the way up to just various other health disparities. But we integrated everything by bringing in Dr. Kamara Jones, and she talked about a story that she wrote about the gardener's tale and how we can actually have a conversation with non-minorities for them to kind of fully understand what some of the issues are in a non-threatening manner. And it turned out to be an exceptional attended event, as well as a very acknowledged event. And we went over to have a collective meeting that Dr. Jones actually facilitated. And around that panel, around those tables, were all of the health leaders in the state of Arkansas. And so it was an amazing amalgamation of people sitting at the table, bringing up issues, making a commitment to what they're going to do to try to address each and every one of these issues in their particular organization. All of us directors know that with the limited money, the limited staff, we know that we could not push this forward ourselves. And so getting the buy-in from those larger organizations who could be in 75 counties, who had tremendous amounts of money and staff and resources to make sure that we were hitting all of those elements, it was absolutely phenomenal. So navigating from there, and again, going back to that theme of buy-in, one of the things that I brought to my staff was, let's do something that was somewhat unique and something that goes to the core of what Minority Health Department, Arkansas Minority Health Commission actually did. And we came up with a conference, and it was called Educating, Empowering, and Equipping Communities. And what we did is we brought in a range of quality experts to provide training and certification on conducting health screenings like blood pressure, glucose, cholesterol testing, and addressing tobacco prevention and cessation, as well as CPR training. You know, many of these individuals we viewed as our direct points of contact to aggressively enhance education, awareness, and screenings in those communities that we couldn't get to on a more routine basis or on a daily basis. And so again, looking at that collective impact model, that's what we utilize in order to kind of push a lot of these initiatives forward. And so it was absolutely amazing working with these commissioners, working with the staff that were there. Everybody has already talked about all of the other additional partnerships. And if I left somebody out, I'd probably get called and dinged on. So I'm going to step away from trying to name everybody. But I will tell you that we did do something that was really unique, is that we actually worked to do the first ever Marshallese Camp I Rock, as well as we took Camp I Rock, which was, again, a predecessor's beautiful idea, and we actually made it regional. And so again, we took the same footprint and allowed ourselves to be across the state in 5 different regions doing amazing things. And that level of outreach gave us a different line of sight on what we could accomplish. So again, it was an amazing accomplishment to work directly with the Marshallese communities as well as these others. I would be remiss if I didn't talk about the Marshallese Acculturation booklet that we updated during my time there. And we also partnered with Shorter College for them to establish a Shorter College Health and Wellness Center in 2016. And we actually worked with them so they can actually provide direct medical services for Shorter College, faculty, staff, students, and as well as individuals in the community. So even though my tenure wasn't as extensive as a lot of others, I took to heart the overall vision and mission of the Minority Health Commission, and I really tried to drive it home. In following up with Dr. Gardner, is that I also participated in representing the Arkansas Minority Health Commission as we retooled the Medicaid expansion. So Governor Hutchinson went from, a lot of people called it Obamacare, to Arkansas Works. And so I applaud him in maintaining that law, because it afforded Arkansans that ability to continue to have access to care that they did not have before. And so one of the things that we were charged with, very similar, was to get out in the community to bring physicians and pharmacists and all of them together to have that conversation on what that impact would be if it went away, and what's the impact if it were to continue. So it was a big accomplishment to participate on that. The last thing that I want to do, because I want to be mindful of everybody's time, is I want to go back and just basically say, again, the staff. They were absolutely dedicated. They were resourceful. They did their jobs a lot of times behind the scenes, did not get the credit that they deserve. I'm here to give them some absolute credit. I'm here to acknowledge our commissioners in what they did, going out, shaking hands, going around the state as well, being that front person, being that extra sounding board when the executive director could not be there. And so we worked as a collective. But the last thing is, whether intentional or unintentional, and again, Dr. Gardner brought this home, there have been some drafted and implemented laws, policies, procedures, and programs that have had long and negative impact on minorities in Arkansas. And one of the things that the Arkansas Minority Health Commission does, it puts us in that conversation. It puts us on that cutting edge for us to be in the room, to have those conversations, to bring forth the necessary evidence in order to tweak and change, and also be part of that implementation of these laws, policies, and procedures in those communities. So amazing work that we have done collectively. I, again, applaud all of my predecessors and those that became behind me for doing the yeoman's work. Dr. Elders, you blessed me with Dr. Edith Irby Jones to be in the same room with me. And it's something that I walk away with as a cherished memory. And so thank you.
Thank you so much, Dr. Knox. We appreciate all that you have done for the Arkansas Minority Health Commission. Our sixth former director is Sharonda Love, who had her tenure from 2017 through 2021. Welcome, former Director Love.
Good evening.
We would love for you to share a bit about your time at the Arkansas Minority Health Commission and your initiatives that you implemented to help to eliminate health disparities in Arkansas.
Well, for sure, I feel like I have been truly blessed to be a part of the Arkansas Minority Health Commission. I can say that I stand on the shoulders of giants not only in our US history, but especially in Arkansas history. And everyone has had the opportunity to see today where the work that those giants have done. So first and foremost, I would like to just say thank you. Thank you to all those who have come before me to show me the way to help to provide access for minorities throughout our state. And I hope that those that come after me will be able to get access to the same resources that I was able to receive. Every time that I made a call or I sent an email, everyone on this panel, everyone that were former commissioners, current commissioners, always said yes, and we're willing to help. And so everything that has been done during my tenure was because of the resources and support that I received. And through those resources and support, we were able to implement the first state-owned mobile health unit. I am just so honored that Dr. Elders mentioned that earlier, because that is something that we are able to provide to the state and will continue to be offered statewide. When I came to the commission, we were partnering in 50 counties with 50 organizations providing access to preventive health screenings. And my goal was to see us reach all 75 counties corner to corner. And in an effort to do that, worked through the governor's office to receive access to funding to purchase the mobile health unit. The initial idea was for us to partner with food banks and drive to the pantries when people were receiving other services, namely healthy food, and provide access to preventive health screenings and health education that was in plain language that folks would be able to understand, but also see themselves when they read the materials. And that partnership grew beyond what I could ever imagine. And so we moved from just working with food pantries to nonprofits, schools, community-based organizations, faith-based organizations, state agencies. And when I left the commission, we were partnering with 136 organizations, corner to corner, everywhere in our state. And when the pandemic hit, we were providing access to upwards of 28,000 preventive health screenings and 36,000 health education encounters. And that leadership from the commission and our team reaching out and being able to truly collaborate and partner afforded us the ability to serve as oversight for CARES funding with the COVID pandemic. And we were able to execute almost $11 million into communities of need, truly meeting the people where they are when they need it at most during this pandemic, providing access to testing. And then when the vaccine was available, also vaccinations, PPE, food, funeral expenses, you name it. If it was COVID related, we were getting it out to the people. And it is still happening to this day. And so I'm very excited to be able to say that the Minority Health Commission is truly able to work with the people driving into communities of need, reaching the people where they are. The other initiative that I think was a very important one and will truly be able to show impact with health disparities is our Minority Health Scholarship. What we know is disparities are impacting minorities at tremendous levels, and we saw it with this pandemic. And through the Minority Health Scholarship, we will be able to provide access to funds, encouraging minorities to enter in fields of health professions so that when minority populations need to receive access to care, they are able to receive care from people who not only look like them, but understand their culture and speak their language. So that they don't have to feel like they are repeating themselves multiple times and or receiving information that they truly just don't understand. And so it is my hope to see both of those initiatives continue on throughout the duration of the commission and providing access to those most in need here within our state.
Thank you so much, former Director Love, for all that you have done for health disparities in Arkansas throughout your years of service. I have certainly enjoyed hearing about the history of the Arkansas Minority Health Commission and the groundbreaking changes that were implemented throughout the past 30 years from our amazing panel. A big thank you to each and every one of you for participating. It has been my pleasure moderating this 30th anniversary celebration. Now let me turn it over to AMHC's Interim Director, Esty Frazier.
Thank you so much, Commissioner Rice, and also our amazing panel for their dedication and their insight. We would like to thank you all for being here to help us celebrate 30 years of improving health disparities for Arkansans. We look forward to seeing you at our State of Minority Health Reception and 7th Biennial Summit on April 21st and 22nd, 2022. At the AMHC, we work today for a healthier tomorrow. This concludes our celebration. Thank you so much and have a great evening.